Are clots during your period normal? Let's begin by taking a look at the TikTok video that made this question very viral. I encourage you to head to the comments and see just how many women are impacted by conditions that we are going to talk about in today's video. Also, check out the comments to see how you may relate with women who have been disregarded or put off by their health care provider. So, are clots normal? And if so, what size? Passing of small clots during your period, approximately the size of a dime, are normal, as long as you have no other concerning symptoms with these clots. Let's examine why clots happen during your menstrual cycle. We know that during your menstrual cycle, the lining sheds due to a decline in progesterone levels. This reduces blood flow to your uterus. The body's clotting mechanism is activated to form clots and prevent too much blood from being released. When your clots become the size of a quarter or larger, we may worry a little bit, especially if you have underlying issues happening with it. These symptoms of concern that happen during your period could indicate, keyword could, we need to have you checked out by your healthcare provider first. Some concerning symptoms include dizziness, intense cramping, nausea, fatigue. You're so tired during the day of your cycle that it's hard for you to even function. Nausea, having to change your menstrual cycle products every 1 to 2 hours. Diarrhea, bleeding that lasts longer than 7 days, and migraine headaches. These are just a few. If you have any symptoms that are concerning or making it hard for you to go to school or work during your period, you need to be evaluated by your healthcare provider. Let's take a look at the 6 conditions that may indicate clots during your period are not normal and you may have an underlying condition going on. Number 1, there's growths that can form inside of your uterus. These are called fibroids and polyps. These can cause periods to be heavier and cause large clots to happen during your menstrual cycle. Submucosal fibroids in the uterine lining are the most common cause of clotting and heavy bleeding during your menstrual cycle. They dangle from a stalk-like piece. They dangle from a stalk, and that in turn irritates the surrounding tissue, which can cause tissue to rub off, exposing blood vessels. Fibroids may also apply pressure against the uterine lining, which can cause more bleeding than usual to happen during your period, or bleeding outside of your menstrual cycle to happen. The uterus may not contract properly, which means it can't stop bleeding. Fibroids may stimulate the growth of blood vessels, which contribute also to heavier cycles and longer cycles. Elevated levels of a hormone called prostaglandins may also contribute to these heavy periods and more clotting during your menstrual cycle. Number 2, thyroid. When your thyroid is not functioning properly, it can impair hormone levels, which in turn make cycles to be irregular, cycles to be heavier, bigger clots to happen. Additionally, when the thyroid is impaired, it can affect clotting mechanisms, which also affect the flow of your cycle and clots during your menstrual cycle. We need to have an optimal functioning thyroid for our overall health, especially our menstrual cycles. Number 3, endometriosis. My favorite topic to talk about. Many videos on this topic you can find inside my channel. Endometriosis takes 7 to 12 years for many women to be diagnosed. It's my own personal diagnosis and what I'm very passionate about educating on. This is a condition where the tissue that usually grows inside your uterus grows outside of your uterine lining. Adenomyosis is also a condition where that tissue grows inside the muscle layer of the uterus. The uterus is a muscle, and when there's growth inside of there, this can cause really heavy and really painful periods to happen along with other symptoms. There's other symptoms that go along with these conditions that can cause our cycles to be really heavy and painful. Dizziness, heavy bleeding where you're getting very tired during the day, awful cramps during your period, and you can have these cramps outside of your menstrual cycle as well. Commonly in your pelvic area, your low back, radiating down one or both legs, rectal pain, and more. Make sure if you're going to go and you want to be evaluated for the disease of endometriosis, find an OBGYN who's also an excision specialist. Number 4, blood disorders. Von Willebrand's disease is a very common blood disorder. Platelet function disorders, thrombocytopenia, hemophilia. These are big words, but they are blood disorders that often go undetected. And if you know your family history, ask around. Many have genetic tendencies with a lot of these conditions. Number 5, hormone imbalances. This might look like PCOS. This is a very common hormone disorder that also goes overlooked. There's other associated symptoms with this one, but if you have PCOS or symptoms of PCOS, which include irregular periods, you may not have had a period for several months. You don't know when you're going to get your period. You may or may not have acne, growth, facial hair growth to your face, your chest. Check out one of my other viral videos that went on where hair growth occurs on women and it's not normal. Our nipples, our belly button area, that dark, coarse hair growth can be an indicator that you may have PCOS. Weight gain. You just had this weight gain that came out of nowhere, or it's really hard for you to lose weight. These are just a few of the symptoms of PCOS. We also know something called pelvic inflammatory disease can cause our menstrual cycles to be abnormal as well, and you should be evaluated for this as well. Starting a new birth control, such as non-hormonal IUDs, or your first few months of changing or starting birth control can also cause heavy periods with or without heavy irregular clots. Number 6, miscarriage. Many women become pregnant and miscarry really early on before they may even know that they were even pregnant. We see this cause a heavier, more painful cycle. Please be evaluated by your healthcare provider if you feel you have any symptoms of a miscarriage occurring. Like I said earlier, many of these 6 conditions have other associated symptoms experienced with them, especially if your menstrual cycle is heavy and you have large clots greater than the size of a quarter happening over and over again. Here's the takeaway. If you have any concerns with your menstrual cycle, find a provider who will listen to you. If you have been overlooked or disregarded, or you don't feel heard by your healthcare provider, please continue to find one that will listen. They are out there. You deserve to be heard. You deserve a thorough workup that includes several different ways to go about diagnosing these conditions. And until you feel satisfied or your symptoms have improved, continue to look for a healthcare provider that will listen to you. Thanks for watching. If you like this video, please hit the like button. If you want to see more videos, hit the subscribe button. Share this video with a female in your life that you feel could benefit from learning and becoming empowered to take back control of their healthcare.